Doctors say if you live long enough, you will eventually be diagnosed with a cataract in your eye.
It used to only be diagnosed later in life, but new techniques are now detecting it much sooner. In this vision quest, I caught up with a local surgeon who underwent surgery using the latest technology. He can't believe how much it helped him and let him ditch his glasses.
Let's do it the old-fashioned way.
Dr. Jay Rahman is a vascular surgeon who relies on his eyesight in his intricate industry. He wore glasses for decades before his eyesight rapidly started to decline.
Around 60s or maybe late 50s, I started having problems with my eye. So it was not too bad, you know. I use magnifying glasses for surgery, so it was not too bad. So it went for a long time, and then it really started getting bad.
Dr. Rahman turned to Dr. Pandit at Houston Methodist Hospital for help. He was immediately diagnosed with cataracts.
What cataracts do is they're a natural aging process of the lens in the eye, which then progressively ages and gets brown and hard, so you can't see through it. And as that happens, you can see that the vision becomes blurry, but you also have kind of a yellowish tinge to everything. So you don't see colors naturally, and you don't see as well in low light conditions.
Cataracts are the most common cause of vision loss in people over the age of 40, and it's a leading cause of blindness in the world. Earlier lens replacements either blurred up close vision or immediate vision, which is somewhere in the middle. New technology has changed that. It's a huge advancement.
So the FDA and the Academy of Ophthalmology came together in a task force about 2014, 2015 to come up with criteria to evaluate this new category of lenses, extended depth of focus, or EDOF. The other name is extended range of focus, or extended range of vision. This is a multifocal lens. You can see the intense pattern of rings, and this is the newer extended depth of focus. Again, the new category of lenses that just came out 2 years ago. This is the only lens like that in the U.S.
While these are the large models to demonstrate the lens, you can see here with the clear version, that's the older models. But this one with all the lines around it is what's helping people have near perfect vision. And this is the actual tiny lens that Dr. Pandit implants in the eye through a tiny incision that doesn't even require general anesthesia.
And it goes through an injector like this, so it goes through a little cartridge and an injector, and it just rolls up and it fits into that small incision I was mentioning. It goes into your eye and then it naturally unfolds. And
Dr. Pandit says it doesn't require any stitches and no injections, so patients say their pain is less than 1 on a scale of 1 to 10.
There's no pain at all. Only thing I'd wear that thing for a little while, that eye patch. No, I don't think I took any pain at all.
Dr. Rahman loves gardening and working in his yard. He no longer has to wear glasses outside to enjoy his favorite activities, and no longer wears glasses in the operating room when he is working either.
Yeah, altogether it has been, it really made a big difference.
well, the nice thing is once you have the cataract taken out, it doesn't come back.
Of course, with every procedure comes risk. One of those with this new lens is a possibility of seeing halos or a glare at night. The new lens that offers near-perfect vision is also more expensive than other options and often means major out-of-pocket expenses for patients. And so while this particular patient didn't have side effects, we even heard from a viewer who had the procedure somewhere else, not where I covered the story, and said that the halos were so severe for him that actually had to have the lens taken out and put in an older one put in. So you just have to talk to your doctor, make sure you know which one is right for you. It was right for that patient.
Yeah, well, I'm glad to hear that he is doing so well. That's certainly good news. But you're right, have that conversation with your doctor.
Sure.
It's an important one to have.